My case is a female patient with early onset Alzheimer's disease. The reason for the visit was that the patient was referred by her primary doctor due to early onset Alzheimer's disease and unintentional rapid weight loss. The patient is 5'8". Her current body weight is 120, BMI 18.2. Her usual body weight was always around 160 pounds. The patient and the husband complained that she had rapid unintentional weight loss, which was about 35 pounds in the past 12 months. She exhibits muscle wasting and complains of a loss of appetite. Some of her symptoms include anxiety, depression, brain fog, memory loss, as well as forgetfulness. She also suffers from insomnia. The history of her present illness starts with uncontrolled blood pressure. She's now put on medication for that. She was recently diagnosed with her early onset Alzheimer's disease, although her symptoms were ongoing for the last 2 years. She exhibits unintentional weight loss with wasting, and she has a history of ulcerative colitis, which she had 3 surgeries for in the past. And that's when she was 22 years old, 30 years old, and 37. She's currently 49 years old. She also exhibits a B12 deficiency, which is evident in her blood work. The only allergies she presents with are for the environment, such as hay fever, and she is allergic to shellfish. This is her current med schedule. She was recently put on an Alzheimer's medication. She's on high blood pressure medication, even though she was not on it for a while and her blood pressure was uncontrolled. She takes Tylenol PM, which her husband bought for her due to her insomnia, and she's on a supplement, a B12 supplement, which was bought over the counter by her husband. Her diet is not very healthy. Her husband does not know how to cook, so he orders meals mostly from fast food places such as pizza, Chinese food, McDonald's. He is home with the patient. He recently lost his job and is able to care for her full time. She has snacks such as applesauce, chips, cookies, mostly junk food. Her fluid intake is mostly sweet beverages such as soda, juice, iced tea. She does not really like to drink water. She eats meals and snacks, but only tiny bites, as her husband states, due to her lack of appetite. This is her family history. She does exhibit a strong history of Alzheimer's disease, which her mother and father both had. Her brother's currently alive. He has hypertension, and he also was diagnosed with Alzheimer's disease about 4 years ago. She has 3 children. All 3 of them are morbidly obese. However, otherwise they are healthy. And her grandmother on her mother's side also had Alzheimer's disease. And her grandfather had diabetes and hypertension. Other family history is unknown. Social history. She used to work as an elementary school teacher for many years. She had to retire recently due to cognitive decline. She's married. Her children are 29, 28, and 22. She used to have a pretty good social life. However, when her cognition started to decline, she stopped being active socially. She's been married for 25 years, and her husband is the sole caregiver for her. Her children are not in the home anymore. This is what was found from the nutrition-focused physical exam. She has high blood pressure. She has been put on meds recently, so hopefully that will be controlled. Heart rate normal. She has dry skin and scalp, and her hair is falling out. Not extreme, but it is falling out. It looks like she has amalgam fillings, and her tongue was thickened and scalloped. She has dry skin on her torso, and her abdomen has mild bloating. She does show signs of wasting in her shoulders, arms, and her hands and feet are cool to the touch. Otherwise, everything is within normal limits, such as her nails and her fingers. These are some of her basic labs and tests. The blood pressure, like I said, was high. Cholesterol is okay. Fasting glucose was kind of low. She does exhibit some dizziness, weakness, not all the time. Her A1C was very good. She has a low vitamin D and B12. Her thyroid was within normal limits. She did not get any functional labs as of yet, but I did speak to the doctor who is going to try to do the neurotransmitter testing with the dry urine test. This is what they're going to test for, as well as heavy metals, so we're going to see what happens with that. These are some of the supplements that I recommended, and we will revisit this once the ZRT test comes back and I speak with the doctor. So in summary, LP is a 49-year-old female with early onset Alzheimer's disease. The main reason she came to me is the complaint of unintentional rapid weight loss, which was between 30-35 pounds over the past year. Her memory is not really good anymore. Cognition is declining, and she does have some anxiety, depressive symptoms as well. She also has some GI bloating and cramping, but not too severe. The main problem is the weight loss and her cognition. Her present illness consists of high blood pressure, which she's had for a while, but only recently been put on meds. She was recently, very recently diagnosed as early onset Alzheimer's disease. Also the rapid weight loss with wasting, and her history of colitis. However, her colitis is controlled at the present time. Past history, she has 3 children, all normal deliveries, no problems with that. But she did have the 3 surgeries for her colitis, which I believe, as the doctor believes, is the start of this problem. And the B12 deficiency. She used to get B12 shots, but she hasn't had them in a while. That's why her husband bought the over-the-counter vitamins as a supplement. Family history is really strong to indicate her getting Alzheimer's disease, which is evident in the recent diagnosis of the early onset Alzheimer's. And according to her nutrition focused physical, it's indicative of muscle wasting, which is probably from the rapid weight loss and lack of nutrition due to her cognitive state. B12 deficiency. She seems to be a little bit dehydrated and possibly have other vitamin deficiencies in addition to B12 and vitamin D. So my plan for her would be to put her on the MIND diet, which is a variation of the Mediterranean diet, which can help neurodegeneration delay. I want to emphasize fruits, vegetables, whole grains, legumes, fish, seafood, unsaturated fats such as olive oil, avocado, and so forth. I want a limit on the SAD diet, such as Processed foods, I want her husband to limit red meat, eggs, and sweets, especially the sweet beverages. I want to try to help her lower the blood pressure as well. In addition to her meds with the diet, we're going to try to stabilize her vitamin deficiencies and help detoxify her. We're just waiting for tests to come back with like the heavy metals, neurotransmitters, and other vitamin deficiency tests. And I want to try to build up some of her muscle mass that she has lost and her body weight. I do recommend that she walk at least 3 to 4 times a week with her husband for at least 20 minutes, not in a rapid pace, just in a pace that's good for her, comfortable for now. Deep breathing, again, practice that with her husband upon waking and especially prior to bedtime to help her with the insomnia and maybe get her off the Tylenol PM. I also want to help the husband to learn how to make some healthy dishes for his wife. This way she can eat healthier and he doesn't have to stress too much and doesn't need to buy the food out of the home. Other instructions would be to help, like I said, the husband not only cook but pre-plan the meals for the week, include organic fresh fruits and vegetables, nutrient-dense foods, nutrient-dense lean proteins. Make sure her water is purified and that she sips throughout the day so she gets a sufficient amount. I wouldn't recommend she drink water right before meals or with meals in order to increase her caloric intake. The deep breathing meditation techniques and the daily walks. I would also recommend she follow up with a primary care physician to get referred for endocrinology, cardiology, gastroenterology, a neurologist, and to see the dentist to make sure the fillings are not amalgam. And if they are, maybe they can change the fillings. And I would recommend that she follow up with me 2 to 4 weeks, but I would call her husband probably in a week to see if he needs any more help, if he needs an appointment prior to the 2 to 4 week time frame. And these are my references that I used. And once we get the blood work back, I will revisit this. And if you have any questions, you can let me know. This is an actual patient at my clinic. Thank you for listening.